Welcome back to the deep dive. Today, we're looking at a part of the body we pretty much ignore most of the time.
Or feet and legs.
Exactly. But it turns out they might be sending some of the most urgent warnings about your heart.
It's a premise that really surprises people. We know that over 6 million people in the U.S. are living with congestive heart failure, or CHF.
6 million. That's a huge number.
It is. And the critical thing we have to get across right away is that the first sign is almost never that dramatic, chest-clutching scene you see in the movies.
Right, that movie myth really needs to go away. So if it's not the chest, where is the body actually signaling that there's a problem?
Well, the symptoms pop up in the extremities, and they show up in ways that are, really subtle. So subtle that a staggering 94% of people just dismiss them.
They blame it on what? Getting older.
Getting older, being a bit overweight, maybe standing too long at work, all the usual suspects. But what we're talking about are these chronic, persistent changes. It's a profound signal that the heart is struggling.
So our mission today is to unpack 12 of these scientifically demonstrated symptoms. We've gone through research from major journals to connect these seemingly minor issues directly to a decline in the heart's pumping capacity.
And we've grouped them by their underlying cause. First, problems with blood flow and prioritization, then the whole story around swelling, and finally things like functional limits and nerve signals.
Understanding these early can be life-saving.
Absolutely. So let's start with, I think, the most common and most commonly ignored one.
Okay, let's do it. Symptom number 1, cold feet. We all know someone who complains about this, and we just say, put on thicker socks. How is this a heart issue?
What's really fascinating here is the why. The coldness is actually part of a deep physiological survival mechanism. When the heart starts to fail and can't pump as much blood,
The cardiac output drops.
right, and when that happens, the body has to immediately prioritize where that limited blood supply goes.
To the most important organs first, the brain, kidneys, lungs.
Exactly. And your feet, being the furthest away and not, essential for minute-to-minute survival, they get pushed to the very bottom of the priority list.
So how do you tell the difference between regular cold feet and CHF-related cold feet?
The key is consistency. Your feet might be cold outside, but they'll warm up with activity or warm socks.
Right.
CHF-related cold feet stay consistently cool, sometimes even frigid. Patients describe it as feeling like they're shivering on the inside, even if they're under a warm blanket. The heart just can't get the warm blood down there.
That makes the distinction crystal clear. Okay, moving to number 2, pitting edema. You mentioned there's a simple test for this.
Yes, and it's a really powerful diagnostic tool you can do yourself. If you have some swelling in your leg or ankle, just apply firm pressure with your thumb for about 10 seconds.
Okay, 10 seconds.
Then you lift your thumb. If a deep indentation, a pit, is left behind and it stays there for several seconds, that's pitting edema.
And the fact that it doesn't spring right back tells you something important.
It tells you everything. It shows the tissue is completely saturated with fluid. This is very strongly linked to right-sided heart failure.
The right side of the heart, what does that do again?
It's responsible for taking the deoxygenated blood that's coming back from the body and pumping it into the lungs to get more oxygen. When it fails, that blood just backs up massively.
Like a traffic jam.
A huge traffic jam. And that pressure forces fluid out of the veins and into the surrounding tissue. That little pit shows just how saturated everything has become. It's a sign of a systemic overflow.
Let's shift from backups to the machinery of movement. Symptom number 3, sudden muscle weakness in the legs. This is more than just feeling a bit tired, right?
Oh, much more. This is a critical signal that the basic cellular function of your muscles is being compromised. The leg muscles just aren't getting the oxygen and nutrients they need to contract properly.
I remember the research on this was incredibly specific, down to the molecular level.
Yes, and this is where it gets really interesting. Groundbreaking research found that patients with advancing heart failure have significantly lower levels of something called myosin heavy chain protein in their leg muscles.
Myosin heavy chain protein. What is that in simple terms?
Think of it as the engine. It's the actual molecular machinery inside the muscle that's required for contraction, for generating force.
So the muscles are literally losing their engines?
They are. The muscle structure is breaking down. And that's why people report this profound weakness, not just fatigue, but real difficulty doing things like climbing stairs or even just standing up from a chair.
And the most worrying part was that the research suggested this damage can be permanent.
That's the truly sobering takeaway. The muscle damage can persist even after doctors improve heart function with medication. It suggests there might be an irreversible structural change.
Which means waiting until it gets bad is a huge mistake.
You've potentially missed the window for a full functional recovery.
Okay, that leads right into symptom number 4, which is also about overload. Abrupt weight gain. And we're not talking a pound or two.
No, we're talking about gaining 5 to 10 pounds overnight, or maybe 10 to 15 pounds in a single week. This is a classic primary red flag.
And this isn't fat, it's fluid.
It's all fluid retention that the failing heart and kidneys just can't process. And of course, gravity pulls most of that excess fluid down into the lowest points.
So your calves, your ankles, your feet.
Exactly. That's why people suddenly find their jeans are too tight, their shoes don't fit, the weight gain is concentrated in the lower body.
Let's talk about a symptom that is visually quite alarming. Number 5, a bluish or dusky tint to the skin. The medical term is cyanosis.
Right. And cyanosis is a medically significant sign. It's a visible reflection of a crisis happening at the cellular level.
What causes that specific color?
It's all about oxygen. When circulation slows down because the heart is failing, the blood that's in your legs gives up its oxygen to the tissues.
And blood without oxygen looks different.
It looks darker, more bluish. And because of gravity and the slow flow, this deoxygenated blood just pools in the lower legs and feet. Seeing that dusky tint is a direct sign that the cells there are literally starving for oxygen.
Wow. Okay, now for symptom 6, which might be the one people notice most often, general ankle swelling or edema.
It's the most commonly reported sign because it's so obvious. The backup we talked about before, the traffic jam, it increases pressure in all the veins.
And gravity does the rest.
Gravity does the rest. The extra fluid gets pushed out and pools in the ankles because they're the lowest points, the primary gathering spot.
So lots of things can cause swollen ankles. A long flight, for instance. How do you know this is different?
It's about the pattern and the persistence.
Mm.
Swelling from a flight goes away pretty quickly once you walk around or put your feet up.
Right.
CHF-related swelling gets progressively worse throughout the day. You might wake up and your ankles look normal, but by bedtime, they're noticeably swollen and tight. And putting your feet up only gives minimal temporary relief. It doesn't really go away.
That steady worsening is the key. Okay, let's move into our next group of warnings, starting with number 7, sluggish healing of sores. So a small cut that just won't heal.
This is a really dangerous one. Healing is one of the most metabolically demanding things the body does. It needs a ton of resources.
And a failing heart can't deliver them.
Exactly. The research points to a 3-part failure. First, there's tissue hypoxia, not enough oxygen. Second, a reduced immune response because the immune cells can't get to the site efficiently.
And the third?
Third is just generally hampered circulation. The platelets, the growth factors, all the little building blocks for healing can't reach the wound, so healing just stalls. A minor scrape can last for weeks or even months.
And become a serious infection risk.
A huge risk.
Next is number 8, which sounds incredibly frustrating. Leg cramps or pain while walking, the kind of pain that forces you to stop.
It's called claudication, and it is one of the most functionally limiting symptoms. It really impacts quality of life.
It sounds like the muscles are basically screaming for oxygen that the heart can't provide during activity.
That's precisely the mechanism. Your big leg muscles need a lot of oxygen when you're moving. A healthy heart ramps up to meet that demand. A failing heart can't.
So you hit an oxygen deficit almost immediately.
Almost instantly. And the result is that deep, burning, cramping pain that makes you stop. At first, it might just be when you're walking up a hill. But as things progress, it can happen just walking across a room.
Now for one of the most surprising connections, symptom number 9, restless legs at night. The source said this affects a shocking 78% of sufferers, but almost no one thinks to connect it to their heart.
It's a critical nighttime symptom. And there's a clear explanation for it that involves fluid dynamics. All that fluid that gravity pulled down into your legs during the day.
It has to go somewhere when you lie down.
It has to go somewhere. So when you lie flat, that fluid starts to redistribute back toward the core of your body. This shift changes the pressure in your legs, it alters the local electrolyte balance, and it can directly compress small nerves.
And that's what causes that awful crawling sensation.
That's it. That tingling, burning, or just that profound, uncomfortable urge to move your legs for relief. It's a direct result of the fluid pooling during the day.
Let's move to our final set of signs, which are about the skin and chronic changes. Number 10, a sudden worsening of varicose veins, or new ones appearing quickly.
Yeah, people tend to see varicose veins as just a cosmetic issue, but a rapid change is a major clue. Varicose veins are caused by failing one-way valves inside your veins.
And the heart failure just makes it all
And
worse.
substantially worse. Remember that systemic backup, that increased pressure throughout the whole venous system?
Right.
That puts enormous constant stress on those already weak valves in the legs, causing them to fail much faster. People will notice their varicose veins suddenly get much bigger, more painful, or more numerous in a very short time.
Number 11 is another one you can see. Skin modifications. The skin on the lower legs looking shiny or stretched.
This is a direct result of the skin structure being changed by all that fluid retention, by the edema.
So it's literally stretching the skin taut.
Like inflating a balloon. Normal skin has texture, pores, little wrinkles. When it's stretched that tightly, all those features get flattened out.
Which gives it that smooth, shiny look.
Exactly. Sometimes it almost looks translucent. It's an unmistakable sign of major fluid overload in the tissues, and it also makes the skin very fragile and prone to tearing.
And finally, we're at symptom number 12. Persistent numbness or tingling, that pins and needles feeling that just doesn't go away.
There are really two things happening here at once. The first is just simple mechanical compression. The swollen, fluid-filled tissue is physically squeezing the small peripheral nerves,
Causing them to misfire.
causing them to misfire. But the second mechanism is even more direct. It's a decreased oxygen supply to the nerves themselves.
The nerves aren't getting enough blood.
Right. Nerves are highly metabolic. They need a constant flow of oxygen. When they don't get it, they get distressed and send all these junk signals to the brain, which we feel as tingling, burning, or numbness.
And that can become constant.
It can become constant and severe enough to interfere with balance and your ability to walk safely.
So after this deep dive, it seems incredibly clear. Your legs and your feet are not just things to stand on, they are sophisticated early warning systems.
They absolutely are.
These 12 symptoms, from cold feet that won't warm up to swelling that gets worse all day, they're not just minor annoyances, they are evidence-backed signs that your heart needs help.
And we just can't overstate how important early intervention is. If it's left unchecked, heart failure claims more lives than many cancers combined. It's that serious.
But the good news is that treatment works.
The treatments, the medications, the lifestyle changes, they work remarkably well when the condition is caught early. Their effectiveness drops significantly in the more advanced stages.
So if you're hearing this and recognizing a cluster of these signs, that progressive swelling, the sudden weight gain in your lower body, that profound muscle weakness, it's time to get it checked out.
Please do. And as we finish, I want to leave you with one final thought. Remember what we talked about with the leg muscles? About the potential for irreversible structural damage? That loss of the myosin heavy chain protein,
The engine of the muscle.
the engine. This raises a really important question for the future. Given how much this muscle damage impacts quality of life and mobility, how might therapeutic research need to shift its focus?
Meaning not just focusing on the heart.
Exactly. Should we be focusing less on just perfecting the heart's pump function and maybe more on developing targeted, direct cellular treatments that are designed to rebuild that essential muscular machinery down in the legs?
Yeah.
That's a fundamental question for the future of cardiac recovery.